Welcome back. This is Africa 54, and joining us now is Africa 54 health correspondent Linord Moudou. Hi, Linord, and what do you have for us today?
Hello, Dimiake. Hello, everyone. Ethiopia is improving water supply and health services in remote regions of the country. Residents in the northern Mashakel district no longer have to walk long distances to retrieve water after more than 100 water points were constructed in the area. The water point was rehabilitated last year with support from donors and now serves more than 480 households. The construction of the water point is helping increase the village's water and sanitation coverage to 60%. The project also includes a community-based nutrition program that has helped reduce cases of malnutrition among children in the region.
In 2012, about 45 water points were built and more than 78 water points are under construction this year. These water points have increased coverage by about 20%. The support our community is getting from UNICEF and the European Union is significant.
Before, we had about 88 cases of severe malnutrition. This year, we only had 40 cases.
And health extension workers are being posted to remote areas to boost health education for mothers. They are providing daily nutrition interventions and health services to millions of people across the country. UN observers say Ethiopia is on track to meet the Millennium Development Goal 4, which aims to reduce child mortality by 2/3 by 2015. The country's First Lady, Roman Tesfaye, praises the critical role of health extension workers in achieving Goal 4.
You know, in Ethiopia, what's peculiar these days is that of health extension workers in Ethiopia. More than 35,000 health extension workers are women. They are outreaching door to door. They are teaching the prevention of preventable diseases. They provide a service in health clinics all over the country. And this had tremendous impact on reducing the infant mortality. And the whole setup of universities and colleges in the country, we train health officers, we train medical doctors, we train and educate in relevant fields. And as well, girls are educated when they are exposed to knowledge. Then they will put it in practice. They take care of their children. They prevent them from illness, diseases which are impacting at infant level. So all these policy impacts, strategy impacts together contributed to the infant mortality reduction as well as to other MDG goals.
And now to tuberculosis. The scourge of the disease took a toll on Nelson Mandela's health. Mandela, who contracted tuberculosis during his nearly 3 decades of incarceration, was hospitalized repeatedly during the past several years, most recently for a recurring lung infection. TB is a treatable disease which killed 1.3 million people in 2012. 74,000 children die from TB each year. Sub-Saharan Africa and Southeast Asia are home to the highest TB burden. Voice of America's Khalil Gueye reports.
These babies are separated from their mothers as they receive much-needed care in the hospital while treated for tuberculosis. The young are vulnerable to TB and have been neglected in research, according to a new report by the World Health Organization. TB medication has not changed in decades. These pills are hard, bitter, and difficult to swallow. They can make children nauseous or, in extreme cases, lead to a loss of hearing. Their native South Africa counts among the top 10 countries in TB burden. The Philippines also is home to a high TB burden. Here, Joseph Lee bears more than a typical teenager's burdens. He is tired after a long struggle against multi-drug-resistant tuberculosis, or MDR-TB.
It's discouraging sometimes. I don't want to tell others about my illness. I was at school and undergoing treatment both at the same time. I would go to school in the morning. In the afternoon, I would go to the hospital to take the medications. There was no time for a break.
Standard medicines to treat Joseph's MDR-TB are ineffective, and many second-line drugs cause severe side effects. But a new therapy is offering hope. Joseph is taking part in an innovative trial of a new MDR-TB compound at the De La Salle Health Sciences Institute. His doctor, Melchior Friars, keeps a close eye on Joseph's treatment. Joseph's trial involves a novel compound developed by the Japanese pharmaceutical company Otsuka. Joseph is the first patient.
It's very difficult to diagnose MDR-TB among pediatric patients because of the lack of diagnostic criteria, or if there is diagnostic criteria, these are ordinary signs and symptoms that you can identify in patients with ordinary tuberculosis, not really multi-drug resistant tuberculosis.
Dr. Tarsila Glur is a clinician overseeing the trial.
This trial gives attention to this neglected group, so it somehow highlights the importance of TB in children, especially MDR-TB in children.
Experts hope Joseph's treatment will yield solutions to treating MDR-TB and saving young lives in the future. That's the goal for more children across the world. Less illness and zero TB deaths in children. Khalil Gueye for VOA News.
And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.